everybody. I'm Rikki Smith. Welcome to Faith on Friday
Faith
Presents.
on Friday, step into what's possible with Rikki Smith.
At Faith on Friday Presents, our goal is to drive motivation by closing the door on the comfort zone, to foster inspiration by showing you what's possible, and to create transformation by challenging those negative and unproductive mindsets. Don't forget, while you're here, subscribe to this YouTube channel, follow us on Instagram, like our Facebook page, give us a thumbs up, and don't forget to share this with your network. All right, parents, think about this if you will. Your little angel pies from heaven, the joy that they bring to the house, the way they make you laugh, the funny things that they say. But then they get sick. What do? Do you wrap them in a blanket, run them over to the ER, and hope someone can save them? Or do you take a moment, stop, and assess yourself and determine whether ER is possible or not? Today we're going to talk to somebody who's going to tell us all the things that we as parents need to know about our kids, the ER, and what we can possibly do at home. But before we get started, everybody, please say hello to our guest, Dr. Nagela Sainte-Thomas. Woo! Woo, 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 woo! Hello, Dr. Nagela. How are you?
I'm good. Hello, Ms. Rikki. How are you?
I'm doing good. Thanks so much for being here with me today, because this is a really interesting subject, because we've all been there. We've all looked at our little angels with a fever and then run them off to the ER. But before we get started, tell us a little bit about yourself and where you are located.
So I'm currently located in El Paso, Texas. I do reside from the East Coast in New Jersey. I had my formal training for my undergraduate, graduate medical school from historical Black colleges such as Hampton University and Howard University. I then did further training and residency at Rutgers in New Jersey, and ultimately my Pediatric Emergency Medicine fellowship at SUNY Downstate in Brooklyn. I came all the way back here to El Paso, which is where my family still was. And I currently work at Providence Memorial Hospital mainly, and I also work at El Paso Children's Hospital.
Wow. So what you just said is you got all the receipts for everything that you do. Clock that. I love it so much. So, Dr. Najla, let me ask you, one of the things you said is that all these things that you have going on as a resident, being people think that being a doctor, first of all, you have to go to 55 years of school, and then you specialize, and then that's another 25 years of school. Why pediatric, and how long did it take you to get there?
Oh boy. So I did undergrad and grad school. So it was like 6 years. I took 2 years to do a master's degree just for a couple of reasons, but I'm glad I did it that way instead of going straight in. So that's 6 years. And then you do 4 years of medical school. So the first 2 years are just more book knowledge. The second 2 years are your clinicals and where you get exposed to specialties that you may think that you're necessarily interested in.
Wow.
And so I initially wanted to do something else, but I decided to go with pediatric ER because I don't really like adult medicine. Adults don't like to take their medication. They usually have an attitude, and that's just not my ministry. But I love
really?
kids. They're fun. Even when they don't feel well, they're usually generally fine. Even my cancer patients, when I was in residency, would be on, a big wheel in the hallway, riding around, screaming when Santa comes. And they have, central lines. They're getting chemo, but they're excited. So for me, I just love their spirit. I love their resilience. And I didn't love enough to do clinic. I don't really want to flip through your vaccinations. I don't want to fight with you about vaccinations. I don't want to refer you to other people. I don't really want to be responsible for that. I do like the camaraderie that I would have with the families and seeing those children grow. I do miss that portion of it, especially when you see them when they're little to when they're older.
Aww.
And then I also like emergencies. And so I thought about the ICU, but I don't have the attention span for that. And so for me, the ER kind of encapsulates all of those things. So it's intensive care medicine. I can still do little babies. I can do the teens. And for the most part, most parents are interested in getting the child well. So they're fairly compliant. And there's not a lot of pushback. And I don't mind pushback, but there can be a point where it becomes very obstructive. And so usually because we both have the same goal, which is to get your child well or to identify what's going on, they're very easy to work with.
Yeah. That brings up this question then. When a parent brings their kid into the ER, pediatric ER, what is something you wish your parents knew coming in?
So we are an emergency department. So you may not be seen right away if your child literally has like a runny nose and cough, even if they have fever. So if it's like a
Mhm.
low grade fever at 100.4, which is what we consider a medical fever,
Mhm.
even 101, if they're generally well appearing, the triage nurse is assessing that as she's getting
Mhm.
your complaint. You may have to wait if I have other sick patients,
Ah.
especially if those sick patients come in even after you. And
Mhm.
oftentimes we have an ambulance bay. So we have children that come in from the back that require my immediate attention. And
Right.
so even though you've been waiting for an hour or two, or even sometimes 30 minutes, I may be distracted because I have another sick child. And not that
Mhm.
your child's not important. It's just that the other child is in a life and death situation.
Yeah.
And so I need to prioritize them. And so I
That,
wish
yeah.
parents knew that. And if their
Mhm.
child came in like that, I would definitely sidestep other patients to
Sure.
attend to their child.
Yeah, that is so good to know because I know a lot of parents, they bring their little angel pies from heaven into the ER. And of course, that is their sole priority is this
Yes.
child. And to see
Yes.
a doctor running past their child to another child who got
Yes.
here after us,
Yes.
it makes no sense. So
No.
that being said, thinking about all the things that as parents, we bring our kids to the ER for. A lot of the things sometimes may not be a real ER visit. So you mentioned earlier a low grade fever versus a medical fever. Talk to us a little bit about that and how can I, as the parent, know the difference and what can I do?
So technically, right, we have to have an objective number. And so our objective number is 100.4 or more. The most accurate temperature is a rectal temperature, which is where you put the thermometer in their bottom. I know lots of people are not a fan of that, but that is what gives us the most accurate core temperature of a patient. So even if it's like 100.3, technically it's not a fever, but I mean,
Mhm.
it's like a low grade fever.
Right.
And in generally healthy child, you can give them medication
Mhm.
and wait to see what happens and call your pediatrician. Oftentimes our pediatricians in the community do have on-call hours, so
Mhm.
you can call into the office and depending on their policy, someone may get back to you to give you some advice.
Right.
But I
Wow,
don't want to
that's neat.
discourage anybody. Like if you're ever scared, that's why
Yeah,
we're in the ER. I don't want anybody to take away from this. Oh, she said that we shouldn't come. I mean, you shouldn't if you don't need to, but if you're
mhm.
worried, it's your baby. And I'd
That's
rather you
right.
come and bring your baby of 2 years old or your baby of 16 years old.
Mhm.
And I tell you that everything's okay, than you stay at home because you were ashamed to come in to
Yeah,
get attention.
yeah. Do you find that a lot, Dr. Naja, that there are parents that will not come because of shame? I thought that was interesting that you said that.
I shouldn't say that. I just said that from what I said. So I think sometimes
Yeah.
people feel bad, like, oh, you said I shouldn't have come for that. So even when they
Mhm.
come in and I tell them that, like, this is really nothing or it's fine.
Mhm.
So
Yeah.
great, I just came in for nothing. It's like, no, it's not that you came in for nothing. Like,
Right.
I'd rather you be seen by
Show
a
up.
pediatric physician. So I'm
Yeah.
going to preface this by saying I am biased for pediatric emergency medicine physicians. We are all actual general pediatricians.
Mhm.
There are some of us that are emergency medicine trained, but they did an additional training fellowship in
Okay.
pediatric emergency medicine. So
Wow. And I guess that would
emergency
be
medicine
different.
docs can see them, but we are
Yeah.
pediatricians.
Yeah, y'all are actual pediatricians. And that is
Correct.
good to know because we out here in, layman's world, we think doctors are doctors. We do understand the concept of a pediatrician versus a geriatric doctor versus a gastro. We get that, but not always knowing when do I take, can I wait? Do I wait? So talking about this, you said stick something up my little person's hoo-hoo in their hiney and get a core reading. Okay, we have digital thermometers. Can't we just wipe it across their forehead or
You
something?
can, but they're not as accurate. I mean, I would say the closest thing would be the tympanic thermometer. So it checks
Mm,
their eardrum, their tympanic membrane. But
hmm.
those are expensive. And I'm like, why spend $70 on something when
Wow.
you can go to the Family Dollar and get, the
Yeah.
$3, $4 digital thermometer? Can
Hmm.
you do it under the arm? Yes, but it may not accurately get that temperature. It
Okay.
may read lower than it really is. Or,
Oh.
sometimes if you do that infrared, they're completely off. And I've had patients come in and it's like it was 106, and then they didn't give any medication, and the kid comes in and it's like 101.
Right.
It doesn't mean that their temperature dropped 5 degrees on the way here. It means that that thing was wrong.
Right. That's so funny. And that's good to know because there are so many kinds of different thermometers out there and everything. So then you mentioned earlier, the runny nose and a cough.
I mean, that
So
I would say that is probably, that and abdominal pain are probably my core diagnoses, like, or
really?
chief complaints in the ER. Ugh, belly pain and constipation, like,
Okay.
they're not constipated. They poop every day. Yeah, just because they poop every day doesn't mean they're constipated. If they're pooping like rocks, like it's constipation.
Mm-hmm.
And you know that your
Wow.
kid is picky, and it's not a judgment. All children of those ages are picky, and that's
Yeah.
usually the most common reason for abdominal
Mm-hmm.
pain. And
Mm-hmm.
then the other one is runny nose cough. Like, can you give me something for the congestion? Like, the baby's congested. I'm like, the baby's 4 months old, but
Yeah.
I can't give that baby anything but a kiss and a hug. But you can
Yeah.
suck in their nose.
It's in about the thing. You talk about constipation with kids. Like you said, is it because they're eating? Are they not drinking enough water? Because those are the most common things that we as parents think of. You're constipated, oh, drink more water. You're
Well, it's
constipated, eat a vegetable for the love of God. I don't mean, what
yes.
is it?
Yes, and eat a vegetable other than a carrot, and eat a fruit other than a grape. Like, you need real fiber sources, green leafy vegetables, and you need water, right? So,
Mm-hmm.
culturally where we live, it's very carb heavy, right?
Mm-hmm.
So
Yeah.
rice, beans, which actually does have fiber in it, or
Mm-hmm.
tortillas. But we also have a lot of fast food here.
Yeah.
And most patients that come in, they have a heavy fast food diet, or
Mm.
they're just like super picky. So all they eat is, chicken nuggets and
Right.
celery sticks. And it's like,
Mm-hmm.
that's not going to get them bowels going.
That's not gonna get things moving. So, what do
But you
you
can
do
do
with your
natural
picky
things.
eaters? Yeah,
You
what
can
do
do
you
natural
do?
things. So I tell parents they can do papaya, introduce it at a young age because it has a particular texture and
Mm-hmm.
smell to it. So not everyone likes it. If
Right.
you're past that age to introduce it, throw it in a shake, throw in a handful of spinach. It does not have an overpowering taste, and it can be
Mm-hmm.
masked by other things in that smoothie that can help
Mm-hmm.
them naturally have bowel
Yeah.
movements. Apricots, dried apricots. I know that people like to do prune juice.
Mm-hmm.
Prune juice is gross, but you could do
Let's just
regular
start there.
prunes. Regular prunes are okay.
Right.
Those are some natural things. Like, don't do,
Mm-hmm.
if they're constipated, they shouldn't be eating a banana every day, 2 times a day. They shouldn't be
Wow.
eating applesauce every single day if they're constipated. Those are very binding things.
Okay.
Um, what I tell parents, especially for the older kid,
Mm-hmm.
tween, or even a teen that may not like water, they can
Mm-hmm.
flavor the water with fruit, right?
Yeah.
So you can do orange slices in water, or strawberries in water, or blueberries in water, if they don't
Yeah.
want to drink straight water, to kind of avoid some of the sugary
Well,
beverages. But
or
water
you know
intake and
what?
fiber
Put it in a
is what will help.
super cool, sparkly cup. I
Exactly.
mean, I had one of those kids. I hate water. Oh my God, I can't stand the water. And then I put it in a sparkly cup. You know them. You probably can imagine which one it was. Put it in a sparkly cup, and all of a sudden, it's not water. It's
It's
like
not water.
it sounds like amazing.
Exactly. Exactly.
And she still likes a sparkly cup. I'm just saying.
No.
So, so then moving forward, so now you have these kids that come in to the ER, and I'm sure you see some really serious things in the ER. What are some of the things that you are seeing in a pediatric ER?
So some of the scary things that are true emergencies, would be a lethargic child, right? And so lay people use that term very loosely.
Mm-hmm.
Like they say lethargic, well, we mean, that kid's like more like tired. Like, of course you're
Mm-hmm.
going to feel kind of down if you're sleepy. Lethargic means they are laying there, and when the doctor or the nurse comes over to touch them or put an IV, like, their eyes are open, but they're not moving. They're
Oh
not
wow.
fighting you.
Mm-hmm.
They're barely breathing. That is a lethargic child, and that means that their CNS, or their central nervous system, is affected. And
Mm-hmm.
now we're in, kind of fight or flight mode. What is going on? Do we need to
Wow.
protect this airway? Is this
Mm-hmm.
sepsis? Do we need to get access? Do they have significant dehydration because they've been
Right.
vomiting or having diarrhea? Do we need to give them fluids? So, that would be a sick child.
Mm-hmm.
Other emergencies are broken bones. And
Yeah.
so what's important is, if your child has a fall, definitely if they have an obvious deformity in that arm or that leg, do not give them anything to eat or drink. Like, this is not the time to stop and
Really?
get McDonald's because they're feeling upset after they've been
Mm-hmm.
splinted. Because typically those patients require sedation. And to get
Mm-hmm.
sedation medications, you need to have a fairly empty stomach so we can prevent something like aspiration, where they vomit the contents of their stomach and then breathe it in.
Mm-hmm.
So if that happens, that's usually what I try to tell parents,
Yeah.
because the schools don't always tell them that not to eat. So oftentimes they'll pick up food on the way,
Oh,
thinking
goodness.
they'll be in the ER a long time, and that just
Yeah.
prolongs our time. Other
Wow.
emergencies, head traumas, whether it's
Really?
from a concussion in sports
Mm-hmm.
to a fall from, their bike and they're not helmeted, or they're in a car accident and they're not
Yeah.
buckled properly. Those
Mm-hmm.
are emergencies.
Yeah.
Breathing difficulties. So this is peak asthma season
I was
because of the
gonna
allergens
say,
in the air.
yeah. Mm-hmm.
And so typically most parents with asthmatics, especially if they have significant asthma, the parents are really on top of them.
Right.
But I would rather you come to the ER for asthma
Mm-hmm.
in patients, especially in the evening. I would not wait till the morning to see parents. If you're noticing, or excuse me, pediatricians, if you're
Mm-hmm.
noticing that they're breathing labored, meaning you're seeing their tummy muscles go in and out really hard and really
Mm-hmm.
fast, or you see their nose is flaring like this,
Right.
that tells you that they're really struggling to breathe.
Mm-hmm.
And I would bring them in immediately.
Yeah.
Definitely, if you see blueness in their lips, around their mouth, I would call 911 and then come.
Really? Oh my
Yeah.
gosh. See, and it's stuff like that we don't know. You mentioned something, the nighttime versus the daytime. And in my mind, ERs are for some reason busier nights and weekends. Is that fair to say?
Yes, it's after work. Parents are now home and free to come and bring them in. And then
Yeah.
all the doctor's offices are closed,
True.
right?
Yeah.
So,
That is
yeah.
so true. And when
Mhm.
the little angel pies from heaven come in, like you said, I love what you said, they're usually more upbeat, a little bit more positive, even if they feel bad.
Yes.
What type of person does it take to be a pediatric doc? Because in my mind, it's somebody that's super fun already or has kids of their own or whatever. What would you say to that?
Absolutely. I mean, we definitely have a stereotype. Like, we're very fun, easygoing. We're very playful. I think sometimes parents get annoyed with me because the minute we walk in the room, and this is from physicians to nurses, you're trained in the ER to learn the difference between sick, not sick. So the minute I walk in the room, I'm looking at your kid. You don't go directly, especially to the smaller kids, because they're already screaming half of the time. You're a
Right.
stranger, you're in scrubs, they think you're getting a shot. A lot of parents are like, if you don't behave, I'm going to have the doctor give you a shot, which does not help our plight.
Mm-mm.
But
Aw.
we're gauging the situation. And if I see that, yeah, they're probably here with fever, but the baby's sitting up, she's
Mhm.
playing with something from the mom, I'll start to just try to play with them before I even put my stethoscope to them, before I even
Mhm.
slap on a glove. And so I think sometimes the parents are like waiting to hear me hear
Yeah.
their concerns, and I'm busy playing with the kid. And so that's a very typical pediatrician. We're
Mhm.
very good at bargaining. We're very good at bribing. I'm not ashamed to bribe. Now, I don't bribe my own kids. I'm a hypocrite, but I'll bribe your kids.
Yeah, no, that's right.
I need you to take this medication. I don't want you to get a shot. Like, if you don't drink
Yeah.
this, I'm gonna have to give you a shot. So if you drink this, I'm gonna get you
Mhm.
some juice. It's 10
Yeah.
o'clock at night. I'm gonna go find a popsicle so you can have a
Yeah.
popsicle at 10 o'clock at night.
Hey, that works for me. I'm like,
Yeah.
I'll take that. I'll take that deal. I mean, but that's so good because you do. I think a lot of parents they go in the ER, especially for PDs, and you go in there and the doctors are like playing. You're like, my child is going through some things. Like, are they though? And sometimes they just need to get comfortable
Yes.
seeing you.
Yeah,
You know?
especially the toddler range, right? Like, the older kids can
Yeah.
somewhat tell me, but up until about 5, they're leery of you. They don't really,
Hmm.
they're like, I don't know if I can trust you. They have stranger danger. They have,
Yeah.
anxiety,
Hmm.
a separation anxiety from their parent. And so it's important for me to know, is this kid crying because I'm in this room, or is this kid crying because actually something's wrong that I need to figure
Yeah.
out what is wrong?
Hmm.
And so that's a lot of times why we try to build that rapport, right? So if it's a 13-month-old who doesn't know me, who already has a little
Hmm.
bit of stranger,
Yeah.
anxiety, and then parental separation anxiety, if I pull them from their parents' arms
Woo.
to the bed, they're screaming.
Oh
But
yeah.
if they're here because the parents are like, well, I feel like their tummy's hurting. And every
Hmm.
time I touch their tummy, they're screaming. I can't give them an answer like, well, I don't really know if it's a tummy because is he
Right.
crying because I'm here or is he crying because I'm
Sure.
causing pain? And so
Hmm.
because of that, that's kind of why we try to build that rapport, which is a little
Hmm.
different, right, for the teens.
Yeah, for
They're
the
not
teen.
talking to you because they don't talk to anybody.
Because you're not on my phone, so I don't have the time of day for you. I love that though. That's so good. Now, one of the things that we kind of hit on, but I'm thinking about our nursing mothers. Okay, so there's a lot going on with our environment, with our food, with the water, all the things that are happening environmentally. And then you have the moms, the parents, if you will, who want to breastfeed their child. And they don't know if they can, or even if they should, or if breastfeeding is even a thing anymore. How
Right.
do you handle that? And what qualifies you to tell anybody anything about breastfeeding?
So that's actually one of my passions. I struggled a lot with Nyla, which is my
Mhm.
first child, breastfeeding. And so I'm like, I'm a woman, I'm a pediatrician. Why am I having such a problem? Well, because it's a learned experience for both the
Mm,
mother and the child.
yeah.
Yes, you think all over the world people do this, but their states are different. They don't have access to formula. And so if their child does not breastfeed, they die,
Mm.
right? So they'll
Wow.
go through pain, they'll go through whatever it takes to nurse. But
Hmm.
where we're in a more developed country where we have access to formula, if you don't have a great or strong support system, not only at home, but with your healthcare providers, it can be a challenge if you don't have, that support and access. And so
Yeah.
I am actually an IBCLC, which is an international breastfeeding and lactation certification, excuse me.
Hmm.
And so that qualifies me to actually teach, train, and assess breastfeeding mothers and their newborn babies. And so I
Wow.
look at how the baby is latched to the mother. I look at the mother's nipples. I look at her milk supply. I look at how
Hmm.
they're feeding and the mechanics of their feeding.
Wow.
There are lots of things that can contribute to,
Yeah.
unsuccessful latching or
Yeah.
nursing.
It
Now,
is so
I
interesting.
I want to say a fed baby is best, right? They used to have
Mhm.
this thing, breast is best. No, a fed baby. So
So if the baby's
if the
eating,
baby needs to
we're
eat,
good.
okay, we're gonna feed that baby. And if we can't get on the breast this time, it's okay. They'll get some formula, or mom can express breast milk and
Hmm.
give the baby food that way.
Hmm.
But the stress, I don't think people understand the stress that we are under as mothers
Wow.
after just of having a baby. You have all these
Yeah.
hormones going on, especially if it's your first, trying to put this thing on your boob. You don't know what you're doing.
Yeah. What could possibly go wrong?
What could
It's
possibly go
fine.
wrong? And then you have like your husband here, like, how can I help? I'm like, you can't. Can you can you produce milk because you can't help me? Or
It's
you have that
so
mother-in-law that's like, oh, the baby just needs,
yeah.
this and that, or the baby just needs that, or you need to do this. And it's like, no, that's not what they
Yeah.
need. I know what they need. I'm their mother. But what is
Yeah.
helpful is when you've had a baby, usually if you're in a hospital setting, they will have lactation consultants available. If you're
Hmm.
in a birthing center with a midwife or like a doula, they have the expertise as well. But what
Yeah.
you want to look for specifically is someone that has that IBCLC certification.
Hmm.
There are community IBCLCs that you can see with your insurance. Your pediatricians also have access to them and can give you those names.
Hmm.
I too am someone that does that on the side. It's more of a concierge business.
Hmm.
And so I'm someone that you would message, and then I would actually come to your home to provide in-home
Wow.
assessment and care and support.
That is so cool. I
Yeah.
didn't know that you would go to somebody's house
Yes.
to
So
do
it's
that.
it's concierge. So it's
Hence
not
the term. It's in the name, y'all. Concierge. But you're only doing it in our area, I'm assuming. You're not yet, unless they fly you out to
right, which I don't know. I mean, y'all want to fly me out? I'll stop working in the ER. You know what I'm saying?
and I will come and help you get your baby fed. But that's so cool because so many mothers struggle with breastfeeding.
They do. And I was one of those moms that, the only reason why I was saved, honestly, was that my residency program, one of my attendings, told me, because I was already out of residency, I was in fellowship at the time when I had my
Yeah.
first. She said, "Oh, we have this mommy group that's run by
Wow.
two of our nurse and IBCLCs that meet once a week." And after 3 weeks, they were able to successfully latch me. And I
Wow.
nursed not, my first until she was 14 months old, and then my
Mhm.
second till he was 26 months old. So
Yeah. That is I mean, but how cool is that? And
yes,
yay, because it's so true and so funny. You know, you have all these people in your ear and,
you do.
wanting to
You
help and give
do.
you all the great advice. And all you want to
Absolutely.
do is just scream,
Yes. And then you equate your success as a mom, right? And your
Yeah.
competence as a mom to be able to do this. And it's like, no, it's not easy.
Oh,
It's something that you both have to learn, and you
yeah.
have to have grace, and you have to kind of box some people out. And that's okay. It's no
That's
offense to those
good.
family members. They mean well, but
Mm-hmm.
our maternal health also matters as well
That's
as
so
those
true.
babies.
I
Yeah.
love that. So let me ask you then, when you're going into a pediatric, whether it's ER, whether it's your regular pediatrician, a lactation, whatever, are there some questions that as parents, mothers, that we should be asking or should be aware of to be looking for? Do you have anything like that we could use?
I think it's interesting. I think a lot of times we see things on social media, that pull questions. I
Mm-hmm.
say write them down and go to your pediatrician with them. That's who you should be having these vaccine conversations with, not the person
So good.
who doesn't really have credentials, who may have done their research online and may have pulled from certain articles. You have to be meticulous when it comes to pulling articles. Not every article is weighed the same.
Mm,
And you have a lot of celebrities that will weigh in. And so you think, well, they must know, they have money. They must have
right.
access to the best of the best. So they know. It's like, that's a private, personal conversation, right? You've picked your
Mhm.
pediatrician because you trust their opinion, you trust their medical expertise, and this is who you bring your child to when they're well, to make sure to keep them well, and when they're sick
Yeah.
because you want them to get better. So to me, that's a huge trust bond that you
Yeah.
have in
Yeah.
someone. And those are the people that you should be having those questions,
Mm-hmm.
or discussions with, whether it's vaccine health and safety, if you want to travel somewhere, if you want to
Mm-hmm.
try new foods, especially for infants, like that's who you should be
Yeah.
having that discussion with.
That's so
Um,
good.
Definitely ask them about the child's weight. So whenever they have a fever or they get
Mm-hmm.
hurt, you know exactly how much medication that we give. In pediatrics, we give what we call weight-based doses. So we use their
Mm-hmm.
kilogram weight
Okay.
and how we calculate the medications that are needed to properly
Huh.
treat that child. So we don't give them too much or we don't give them too little.
Yeah.
So I would definitely say that.
That brings up an interesting question because in our area, and I'm sure it is where childhood obesity is a real thing. And now
Yeah.
you said we give medicine based on a child's weight. If you have a 5 or 6 year old who is above what their weight limit would be at that age group, do you still give the medicine based on that weight or the weight that they should be versus the weight that they are?
So it actually depends. There are some medicines that we do more for their age, and I
Mm-hmm.
do believe that that's in more subspecialties, so like oncology patients and things like that, or even endocrinologists who are physicians that take care of your glands
Right.
and hormones and such. But typically, the majority of medication we do based off their weight, and we
Mm-hmm.
cap it at the adult dose. So yes, if
I
you
see. I
have
see.
a 4-year-old who is like 50 kilos, which is over
Mm-hmm.
100 pounds, which we've had,
Mm-hmm.
I'm going to still give them, Motrin,
Yeah.
their Motrin based dose. Now, I'm not going to go over 600 milligrams,
Mm-hmm. Okay.
but I'm going to give it based off of their weight.
Mm-hmm. So it's important when you are going to these doctor's visits, find out how much your kid weighs, right?
Yes, yes.
And
Especially
be
when they're
aware.
infants, because they go
Yeah.
so you go every 3 months. In
Mm-hmm.
the beginning, it's every 2 months, and then you go like 3 months
Mm-hmm.
until they're two, and then it becomes annual. I would ask them, especially because they're always having to scrape this, scrape that, trip and fall. Put
Yeah.
ice, like you're allowed to put ice. You're allowed to give ibuprofen and Tylenol over the counter. Now, I'm not
Mm-hmm.
saying to medicate them all of the time, but
Sure.
if your 10-year-old rolled their ankle last night, of
Mm-hmm.
course it's going to be worse today or after school today
Yeah.
when you come to see me because they haven't been medicated and then they hadn't put any ice on it. It's
Mm-hmm.
okay. Apply ice. Give them
Yeah.
some medication to reduce not only the pain, but the
Mm-hmm.
inflammation.
Yeah. That see, you're bringing up all these really cool questions that in my mind. So, what is a common misconception that parents have about their child's medication or their child's health in general that you guys have seen and have had to correct?
Amounts of like Tylenol and Motrin. I have
Mhm.
oftentimes like, oh, well, they're only 7 months old, so I gave them like 1 ml. And meanwhile, it's like a chubby, I eat everything 10-kilo baby. That
Mhm.
baby could have had 5 ml. So no wonder their fever is still at
Mm. Right.
102.5
Hmm.
because you gave, it's like
Yeah.
dropping droplets in the ocean. You're
Hmm.
not giving them anything that's helpful, but parents get very scared to give.
Sure.
It's funny. They get scared to give like Tylenol and Motrin or even like allergy medicine,
Hmm.
but they're not tired or scared to give antibiotics. Like they were like, oh, I had this leftover amoxicillin that, because of the fever, I just gave them a dose last night. When was it even from? Like, was it their amoxicillin? What? Don't do that.
Yeah,
Please don't do
just
that.
just because it's left over doesn't mean we can give it to them. Wow, that is so fun and so true. And many of us have been guilty of it for whatever. Don't judge me. I'm just
Yeah.
saying they all made it out alive. They're fine now.
They
So,
did.
I mean, Dr. Nalja, there's so much information here. And
Yeah.
but the one thing I do want to ask you to give us some quick information on is your concierge service for nursing mothers. Can you get where can we find that information out about you and what it is that you do?
So I do have a website that, I mean, it's still semi under construction, and I do have a work phone. Like I actually still, I'm doing it currently if I'm
Hmm.
referred anyone. And
Hmm.
so you would call, you would leave a message, I'd call back. We talk about kind of what you're struggling or what your concerns are.
Hmm.
And then we would schedule a visit. And so I come out for 90 minutes and
Okay.
I will assess how your baby feeds, how your nipples look to make sure that you're having proper latch, make sure you don't have any trauma on your nipples, make sure there's no infection. Like I do
Wow.
minor things. So if you have a
Hmm.
breast infection or if the baby does have, infection in their mouth, something like thrush,
Right.
I'm able to treat those things. And
Hmm.
then I would make sure that they're transferring milk, meaning they're swallowing and eating
Hmm.
sufficiently. And I do that for about 90 minutes, which would usually cover 1 to 2 feedings.
Right.
And then you
Okay.
have access to me for another 96 hours via text
Okay.
to communicate and see how, if you have any questions about anything.
Hmm.
And then I have some add-on services. So if you wanted me to come
Okay.
back out, I do have plans where you can sign up for a couple of weeks, and that gives
Hmm.
you actually unlimited access reasonably to me and more than one home visit.
Awesome. Don't worry, everybody. If you didn't get that, all of her information is going to be in the description below. So you will be able to reach out to her. And don't forget, subscribe to this YouTube channel, like our Facebook page, follow us on Instagram, share this with your network. We want everybody to know what's going on. Dr. Najla, my friend, before I let you go, we need to play a game.
All
Woo!
right,
This
let's
game is
go.
called This or That. I'm going to give you the choice of a couple of things, and you, my friend, just tell me which one you like the best. Are you ready to play?
I'm ready.
Let's do this.
This or that, this or that. Make your choice, no looking back. This or that.
All right. Are you a planner or do you wing it and hope everything works out?
I would say I'm a wing it. I like to plan a little, but I do a little bit of winging.
And hope it all comes together nicely. I like it. All right. Are you a slow dancer or do you like to shake that thing?
I like to shake that thing, girl.
I love it so much. Parallel parking like a pro or drive around till you can find a better parking space?
Oh, parallel parking like a pro. Okay, learn to drive in Jersey and New York City. I'm good, girl.
Oh, I know that's right. Okay. Morning person or night owl?
Definitely a night owl.
Yeah, that's true. You work ER at night. Never mind. All right.
Hmm.
Sing in the shower or sing in the car?
Ooh, probably sing in the car.
Really? Okay. I
Hmm.
can see you singing in the car. I can actually do that. Okay. Yellow light. Slow down or speed up?
It depends on how far I am from that intersection. If I'm like a car or two, I may speed up. But if I'm a little bit more than that, or if my children are in the car, I will probably be more of a law-abiding citizen and slow.
Oh, so proud of you. That is great. And finally, my friend, what would you now tell your 13-year-old self?
Oh gosh. You know, people's opinions of you don't matter. What matters is that you love yourself, that you believe in yourself, and you surround yourself with people who love you the way you are.
Aw, that
Yeah,
is such great advice. Oh my gosh. Dr. Najla, thank you so much for joining me today. This has been fun.
it has been fun. It's been my pleasure. I'm so happy to have been on here and being able to talk to you about some of these things.
I'm glad to have you. All right, everybody, that's it for this week. But don't worry, we'll be back next week with more. Faith on Friday
what's
presents.
possible.